we used administrative data at the Manitoba Centre for Health Policy to look at the health and social outcomes of individuals who receive a diagnosis related to an alcohol use disorder. What we found is that for many health service indicators, we see a really big spike in access to care, hospitalizations, physician visits, prescription drugs during the year of diagnosis. So at the time they come to the attention of the medical system, a big spike in access to services. The one exception to that was emergency department, where we saw individuals who eventually receive an alcohol use disorder diagnosis come into the emergency department at a much higher rate, up to 1 to 2 years before they receive their diagnosis. So even before they come to the attention of the healthcare system, they're accessing the emergency department at 10, 15 times the rate of the general population. We found that same pattern in social services. So a year to 2 years before receiving an alcohol use diagnosis, individuals are coming into contact with justice more frequently, are relying on income assistance more frequently, are moving into social housing more frequently. So we see that the outcomes of their alcohol use disorder become apparent in their access to social services up to a year to 2 years before they even receive their diagnosis. And in order to provide better support for these people, we need to adopt a whole of government strategy where as these individuals come into contact, we find out if they're struggling with an alcohol use disorder and get them into services even earlier. The mental health and addiction strategy also talks about a culture of shared responsibility, so we as a society can be doing better to support individuals with this mental health disorder. There's a variety of prescription drugs that are available that have been shown to be efficacious to reduce alcohol dependence with people with an alcohol use disorder. And when we went into the data, out of about 37,000 people in Manitoba with an alcohol use disorder who are eligible to receive this prescription drug, less than 2% ever receive this prescription. So a vast underutilization of a potential pharmacotherapy, which has been shown to be efficacious to treat individuals with an alcohol use disorder. If we can identify individuals sooner and get them into treatment sooner, evidence suggests that we'll see a mitigation or a reduction in some of the harms that are associated with this mental health disorder. So reduction in the excess use of healthcare services, reduction in the use of social services. It can really result in savings from a societal perspective in terms of access to services and use, but also better quality of life for individuals with this mental health disorder and as well their families.